Your doctor told you that your knee pain is due to severe arthritis and suggested that you need a knee replacement, but you don't want to have surgery. Or maybe you have other health issues and it's very risky for you to undergo surgery. What are other alternatives to a knee replacement surgery? Today, I'll show you 10 things you can do instead of a knee replacement surgery to alleviate your pain. So let's get started. First, the pain may be coming from the muscles, not the cartilage or bones in the knee. It's common for the pain to be generated by muscles that are too tight or too tense. This is called myofascial pain. You need to stretch, strengthen, do aerobic exercises to pump oxygen to these muscles and relax them. I have another video that I demonstrate these exercises. I'll put a link here for you to watch it later. Second, remember, motion is lotion and your knee cartilage needs lubrication. Give preference to do exercise in the water, such as aquatherapy or hydrogymnastics. These are excellent to reduce the tension in the muscles, but also to help lubricate the knee joint. If you don't know what to do, I have many videos on my channel demonstrating exercises for knee arthritis. And if you need individual help, I recommend you to consult a physical therapist. Third, apply heat to the painful area. A hot pack or a hot towel will have analgesic effects and reduce pain. Fourth, lose weight. Even losing a few pounds will make a huge difference to your knees. The fat tissue produces substances that are pro-inflammatory and they aggravate the inflammation in the joints. The substances are called adipokines. Fifth, modify some activities. For example, you may need to get a cane or a walker. If you sit all day, try to straighten and bend the knee many times. Do not keep the knee in the same position for a long period. Think of the knee arthritis as a knee failure. When an organ is failing, you don't stop using it, you just need to use it with caution. Like the heart, if a person has heart failure, we don't tell the person to stop using the heart. Please remember, this video is not medical advice. If you have a medical condition, please talk to a healthcare professional. If there is an emergency, please go to the nearest emergency department or call an ambulance. This video is for educational purposes only. 6. If you don't have any contraindication, take analgesics like acetaminophen and anti-inflammatories like ibuprofen or celecoxib. Do not use opioids, they are not really good long-term solution. Watch my other video about NSAIDs here to learn more. 7. Adopt an anti-inflammatory diet and drink plenty of water. The anti-inflammatory diet is just a healthy diet. Get rid of processed food and eat plenty of fish, extra virgin olive oil, vegetables, legumes, green leaves, fruits. Alcohol should be cut to the minimum possible. 8. Quit smoking, and this includes smoking tobacco or marijuana. Smoking is bad for the lungs, the heart, may cause cancer and aggravates arthritis. 9. You may ask your doctor to try injections to the knee or nerve blocks around the knee. And 10. You may need to buy special braces to help keep the knee joint aligned and stable. This might help to reduce the pain and you can walk longer and enjoy your life. If you want, you may download this handout on my website to remember all 10 strategies that can be used instead of a knee replacement surgery. Go to my website www.drandreafurlan.com and share this video with anyone that might need this information. There is a share button here and you can send to anyone by email or add a link to your WhatsApp or Facebook group. Thank you for watching. Goodbye.